Good day, listeners. First, I'd like to thank you all for listening to my introductory episode. Now, before we dive into the actual interviews, I think it's important that I define the term elder and elder care, and then we talk about some of the stigma and sensitivity around the issue, and share with you some statistical information about this growing population. So, why do we need, you may ask, we need to talk about this? Because you will learn that the term elder is defined differently based on the context to which it is used and the different agencies providing service. So, for many of us, elder is referred to as an older person, a retiree, a mature, or veteran, and the list goes on. However, according to the Merriam Webster Dictionary, the term elder, when used as a noun, is described as someone who is older, meaning a senior, an aged person, or someone having authority by virtue of age and experience. I like to lean towards the latter one. It sounds much more appealing to me. Now, the dictionary goes on to describe elder when used as an adjective, meaning of earlier birth or of greater age, as in an elder brother or elder sister. However, for medical and legal purposes, elder is defined differently. So, according to the Centers for Disease Control and Prevention, they define elder as someone who is 60 years and older. As for the Centers for Medicare and Medicaid Services, an elder is someone who is 65 years and over. For the Social Security Administration, they define elder as 65 and older, and for full retirement at 67 years old. However, elders can also retire as early as 62. So I would say for Social Security Administration, 62 is sort of that defined age for elder. Now, it gets more interesting because according to the National Council on Aging, they define older adults as parents, grandparents, neighbors, and friends over the age of 55 living at home. This could be due to financial or cost-cutting reasons for different definition in elder among these agencies. But I would ask that you be mindful that these definitions may vary also among different cultural groups and languages as you think about access to care and accessing legal services as well as financial management. So let's now talk about the sensitivity around elder care, like or elderly, like stigma, or avoidance, and work burden. Let's face it, ageism exists. As we grow older, we may experience discrimination at work, at school, in our communities, at different centers that we may access because of our age. However, I found that self perception to be just as harmful as a stigma we sort of place on ourselves. So throughout the years, I've learned or I've heard people complain about the way their bodies are aging, that the dark spots that they're experiencing, graying of the hair, it aches and pains, and often saying, oh, don't get old, which brings me to the other topic. What happens when you do get old and when you need care as a result of getting old? So, how do we then define that? According to the University of Rochester, elder care covers a wide variety of issues. This includes choosing an appropriate healthcare provider to care for an aging person, or part of the decision-making process about whether or not to move an older adult from home to a residential care setting. Um, we're learning, as we're experiencing now, there are many older adults who are living healthy, active, very independent lives, but as they get older in their 80s and 90s, many of them may need assistance with daily living or daily activities of living. And these responsibilities often increase for the caretakers as well. So, um, the way the National Council of Aging defined caretaking or caregiving is as multi generational family and friends who care for an older loved one at home. Now, let's switch gears a bit and talk about some of the statistics, right? And really give um, some rationale for the significance importance of this podcast docuseries as well as creating a documentary on elder care. So in 2021, people 65 years and older represent 17% of the total US population. That's estimated at over 54 million persons in the US. And that's actually expected to rise to 20% by the year 2030, which is not too far from us from now. As people age, we know that the cost of caregiving, specifically healthcare and home care, continue to rise. So it's estimated that the median cost to stay in a private room in a nursing home is approximately $9,000 a month. However, many of us, as we grow older, we want to age in place. So in terms of certain disparities and adverse effects that the elder population may face, the National Council of Aging describes that 15 million Americans 65 or older are economically insecure, and about 80% of them have two or more chronic diseases, which, working in public health, I'm not surprised at all. Um, they also went on to say that 40 million Americans provide unpaid care for older adults and adults with disabilities, the majority of whom also juggle work and other responsibilities and competing priorities, similar to what I experience, as well as so many millions of families experience, which we all know takes a toll in our lives and our stress in our bodies, as well as our families and our family dynamics. So, the National Institute of Aging also describes care to be the following services or activities: home healthcare service, help with everyday daily activities, nutrition, food and meal services, money management, transportation services, emergency medical alert systems, help for the actual caregivers as well, and other professional services. So then how do we then navigate these systems to best care for aging parent? Now, there's one thing I forgot to mention that I think is really important is the issue of um, avoidance and work burden when we have to think about the this enormous task of juggling our own personal lives as well as taking care of an elderly parent, which we're often referred to as the sandwich generation, because we have our kids to take care of and then our elderly parent. Um, the first thing that comes to mind is avoidance, right? And that's due to the multifaceted factors affecting elder care and the complexity it brings. Where it's understandable where people it's too much for us to handle or to manage. I mean, how do you go about establishing healthcare proxy or to have a will, identifying an executor, in the event that your parent or elderly loved one have not done that before they became unable to take care of themselves. How do you then manage or navigate Medicare, Medicaid, Social Security benefits, and veteran services, right, if you qualify for it? I know for me, when I did it for my parents, I recall spending hours online or trying to sort of, find the right form or complete the right application and waiting on the phone for customer service. In addition to that, sort of the burden of sort of taking them to doctor's appointment, getting the right provider. If you come from vulnerable communities, there are providers that may be preying on your parent, as I have experienced. Um, how do you then be on top of these multiple appointments, grocery shopping, laundry, managing what feels like the world on your shoulder? Clearly, I'm still processing this experience. So I'll stop for now. Hopefully, this podcast and our film documentary will help you make it easier for you and for others to understand the process, what to expect, and bring more clarity on the experience of elder care. So stay tuned for the next episode where I will interview an older adult to explore how he navigates the healthcare system, what challenges he encounters, as well as some solutions to these challenges. Thank you again for listening, and please share my podcast to as many caregivers and families and loved ones who would benefit from it.